This is Virginia Henderson's nursing theory, also known as the need theory. Virginia Henderson had many titles, such as the mother of American nursing. Her occupation and education. Starting with her occupation, Henderson volunteered as a nurse aide for the U.S. military. This was during the time of World War I, where patriotic fervor stimulated many to serve. During this time, her two brothers were serving for the U.S. Army, and therefore Henderson was inspired to work as a nurse aide, assisting in the wound care for the soldiers. Then after, she practiced nursing at Henry Street Settlement in New York City. Later on, she became a teacher and clinical instructor at the outpatient department of Strong Memorial Hospital in Rochester, New York. From then on, she taught nursing at Norfolk Protestant Hospital in Virginia and at Teachers College, Columbia University. This was the first and only teacher in the School of Nursing in Virginia. From then on, she decided to pursue a research position. She worked as a research associate at Yale University School of Nursing. During this time, she studied nursing. Her findings showed that nursing research concluded studies of nurses rather than nursing care. During this whole time, she wrote and crafted many influential books, such as The Basic Principles of Nursing, which is now published in 27 languages and is broadly used, The Principles and Practices of Nursing, and finally, she aided in creating the Nursing Studies Index. Henderson received an early education in her youth from a family friend who was a schoolmaster and from her father who was a former teacher. However, she never received a diploma, which delayed her education and application into nursing school. From then on, she enlisted in the Army School of Nursing in Washington, D.C. during World War I. She then graduated in 1921. She received her nursing and education and training. Then she decided to continue to pursue her nursing education. She obtained a bachelor's degree and a master's degree from Teachers College at Columbia University. Her studies with Annie Goodrich caused her to pursue a deeper knowledge in order to contribute to the nursing field. The key points of Virginia Henderson's needs theory is the promotion of patient independence. Virginia Henderson's goal was to promote the autonomy of the patient in their recovery, allowing them to do as much as they could in the process. As she states, the unique function of the nurse is to assist the individual, sick or well, in the performance of those activities contributing to health or its recovery or a peaceful death, that he would perform unaided if he had the necessary strength, will, or knowledge. This theory also outlined the 14 basic needs. The 14 basic needs help to find the needs and require for the overall health of the patient. These needs outlined a holistic approach. They satisfied physical, psychological, emotional, sociological, spiritual, and developmental statuses of the patient. Rather than focusing curing the disease or the physical recovery, it focused on the overall well-being of the patient. Finally, it puts into perspective the nurse's role. The nurse's role came in many forms, such as the substitute, the helper, or the partner to the patient, depending on the level of care that they needed. These are the 14 basic needs: breathing normally, eating and drinking adequately, eliminating body waste, moving and maintaining desirable positions, sleeping and resting, selecting suitable clothes, maintaining body temperature within the normal range, keeping the body clean and well-groomed, avoiding dangers in the environment and avoiding injury of others, communicating with others and expressing emotions, needs, fears, or opinions, worshiping according to one's faith, working in such a way that there is a sense of accomplishment, playing or participating in various forms of recreation, and finally, learning, discovering, or satisfying the curiosity that leads to normal development in health and use of the available health facilities. The benefits of the nursing theory is that it helps define the nurse's role in regards to patient care. The nurse's role is defined as the advocator to the patient's well-being while providing the autonomy of the patient. Next, it provides a standardized assessment. As you walk into a patient's room with the knowledge of the 14 basic needs that a patient needs to satisfy, you're able to check off which needs the patient can satisfy on their own and which needs the patient needs assistance in. And from then on, you're able to declare and determine which role you need to play as a nurse and what you can do to help. Another benefit is that this theory can be applied in a variety of settings, such as hospitals, multiple units on hospitals, hospice, and even nursing homes. Another benefit is that it allows diversity. This nursing theory can be tailored to fit the needs of many different patients, such as a variety of ages, gender, ailments, injuries, and diseases. No matter the scenario, you can use the 14 basic needs to assess the patient's well-being. Some limitations to the theory is the notion of a peaceful death. There's a lack of information on how to carry this out. When you look at the 14 basic needs, it's hard to determine which ones are contributing to a peaceful death. When you look at the 14 basic needs, it seems to provide a way to recovery, and therefore it is hard to determine how to carry out the needs adequate for a peaceful death. Another limitation is that these basic needs are left up to interpretation. Each need is not defined. Some needs go into more detail, such as maintaining body temperature within the normal range by adjusting clothing and modifying environment. However, some are not, such as sleep and rest, or for what specific requirements satisfy sleep and request. That is up to interpretation. Now we have the application of the theory. Examples of applying the nursing theory is, let's say that you have a patient that has difficulty with breathing. And one of the 14 basic needs is that the patient needs sufficient breathing. So in order to satisfy this need, maybe you supply the patient with a nasal cannula and an oxygen tank. And you make sure that the oxygen is carried with them wherever they go, whether it be in the bed or while they're walking around. You make sure that it's with them always. Therefore, they're able to adjust to the oxygen tank and promote their recovery. Maybe you also take vitals, as it's very common in vitals to record respiration rates or oxygen saturation levels in order to observe their progression in breathing back to normal. Another example could be if a patient has difficulty in mobility. Maybe they can't get up at all. So maybe that means as a nurse, you aid them in positioning themselves in the bed if they're bedridden, in order to prevent any unnecessary injuries such as bed sores or pressure ulcers. Maybe they do have some mobility but need assistance, so you teach them how to use devices such as walkers or wheelchairs in order to promote their independence in transferring themselves and leading to their gradual recovery until they're able to move again. My personal view of Henderson's theory is that I believe that the nursing theory will continue to be used until patient care dies. I'm a current CNA, and so I learned the CNA skills that you need to have, and a lot of them are mainly focused on patient care as pertaining to bed baths or Foley care or peri-care or grooming the patient or feeding the patient, emptying their urine, recording their pulse, recording their breathing rate. And so I think that having Henderson's 14 basic needs and being able to assess the patient and what they can do, while filling in the gaps that they cannot do on their own, is very beneficial, because you're able to see that as you're providing in the areas that they're unable to perform, that they're recovering, and eventually they will be able to perform these basic needs for themselves. So these are my references, and that is all. Thank you for listening.